Now it is my pleasure, my great pleasure, to announce Didier Pittet. Beside the fact that everybody in this web room will know Didier, I want to mention that he is the director of the Infection Control Program of the WHO at the Collaborating Center of Patient Safety at the University of Geneva. He is, of course, the lead advisor of the WHO Clean Care, Safe Care program. He holds over 500 publications in this field and holds numerous international honors, amongst them the Command of the British Empire. And since recently, he was given the position of the president of the mission assessing the question of the COVID crisis by the French government, and he was given this position personally by President Emmanuel Macron. Didier is going to speak about environmental hygiene at times of COVID-19, the clean hospital approach. Didier, please.
Hello, and thank you very much. Many thanks, Bernard. First thing, can you hear me? Okay, thank you very much. And can you see my slides?
Didier, we can see your slides, but not your video.
Okay.
I can't see you. Yeah, fantastic. Okay. Welcome to the conference.
Yeah, I was not available to do it earlier. So thank you for inviting me, Bernard, for this introduction. And yes, without further ado, I will be discussing environmental hygiene during the time of COVID-19, the clean hospitals approach. I cannot control my slides, so from distance.
My team tells me that it should be possible. Can you do it from here? Didier, you are sharing. It should be possible from your side.
I know. I'm used to it, but currently it doesn't work. So I cannot change the slide. So I know you have my slides too. So why don't you change the slide?
We're doing this. My team is already working on that. And the moment the second slide is on the screen, we can start. I don't know the reason either, but we have another phrase for 2021 aside from "Can you hear me?" and "You're muted."
Yeah. Okay. Thank you very much. I can see my slides, so I hope everyone, and I guess everyone can see the slides.
Positive.
So importantly, as you reminded us, and if necessary, just to remind you that as a few days ago, the number of cases of COVID is over 110 million patients with so many deaths from all around the world. And that's why I thought it was interesting to today revisit environmental hygiene during the time of COVID. Let me recall to you the transmission of COVID on that slide. As you can see, COVID transmission is basically to the hands of people, not only healthcare workers, but also people in the population, as well as droplets that people who are infected, and sometimes even people who are asymptomatic with no symptoms could actually expel. And that's the way the transmission of COVID is ongoing since more than a year all over the world to reach a pandemic. It's important to remember that in transmission to the hands, there is the direct transmission, contact between people, but also the indirect transmission, which means actually contact through the environment. And that's why certainly this issue of the environment is quite important to understand. Next slide. The next slide is, do cleaner hospitals really mean safer hospitals? And as you know, it's a very important question, because this question has been raised and raised and raised, and sometimes we don't know exactly how important is the cleaning of the hospital to ensure patient safety. Next slide. Next slide is actually reviewing for you environmental health care hygiene, which is actually crucial for fighting COVID-19. It is crucial because this COVID-19 is spreading a lot. It is spreading a lot even without the relative importance of the environment would be monitored. But I can tell you that sometimes when you have actually the capacity to investigate outbreaks in the hospitals or in the community, you immediately realize that the environment is definitively very important. So cleaning, rubbing your hands with alcohol-based hand rub, making sure that the environment is maintained properly is absolutely key. Next slide. Next slide is revisiting for you SARS-CoV-2 in the environment. To remind you that viral RNA is often found on surfaces, and we know that it can stay there for quite some time, from an average of several hours to some extremes like even days, definitively. Then it is possible to keep aerosolized SARS-CoV-2 suspended in the air for a long time in controlled experimental conditions. Also, we don't know what is the realistic and the real importance of this phenomenon in the day-by-day transmission of COVID-19. Third, disinfection procedures drastically lower the viral RNA recovered from the environment, and that's very important to keep this in mind. Whether or not the virus would be actually a living virus that could effectively be cross-transmitted and induce an infection, what is important to know is that definitively when you clean appropriately, you can remove the RNA of the virus that you find on the environment. It is then difficult to culture viable viruses from the environment from all the studies that have been conducted, including studies that we conducted here in Geneva. It is sometimes extremely difficult to demonstrate that the virus that you recover in the environment could grow in the laboratory. But we know that for other viruses, it doesn't mean that the virus cannot infect. That's why the cleaning of the environment is actually definitively so important. Next slide. Now, on the next slide, there are many types of products that kill SARS-CoV-2, definitively. Next, please. Among those tools, heat and steam, the use of detergents, alcohol, that works very well, sodium hypochlorite, quaternary ammonium compounds, UVGI, and other techniques. So in other words, that's a good news. There is no magic tool that is necessary to kill COVID-19 or SARS-CoV-2. But the problem is to apply those technology appropriately. Next slide. The next slide shows you a summary of the enforcement policy for sterilizers, disinfectant devices, and air purifiers during the COVID-19 disease 2019, the COVID-19 public health emergency, the guidance of the FDA. And you can see that there are a lot of active ingredients and product name, many different product name, and the procedure that has been used to prove the role on COVID-19. So as you can see here, the viruses that have been used to test are feline caliciviruses, rhinoviruses, and avian reoviruses, and so on, because COVID-19 has not been used in the laboratory for this type of experiment. But when you know that COVID-19 is a coronavirus that is like many of those envelope viruses, you can perfectly predict and be fully reassured that the compound will be working. Next slide. Next slide highlights for you the EPA tool that you can access, a list of tools that are COVID-19 disinfectants. You can go on the website and you can be sort of driven through those tools. You can browse products or you can search for ingredient registration and according to the environment type and contact time. This tool is very, very convenient. You can access it very easily, and it is something that is very useful for most people working in the field of health, environmental hygiene. The next slide is summarizing and reviewing for you the sort of going further activity, which is using automation. There are all sorts of systems that you can use. I don't want to say that those systems are necessary to be used, but sometimes they are facilitating your work. Sometimes in some type of facilities and local area in the hospitals, they can be useful, and you should not hesitate to use them. They are, once again, not necessary to fight COVID-19, but they can be absolutely useful and very easy to implement most of the time. Next slide. One of the questions is hospital environmental hygiene cost efficient? The real question is now, what is the cost of not cleaning? Investing in quality is worth it, both in economic and human terms. This is absolutely key because, in fact, if you don't invest in cleaning the environment, you will pay for it. You will pay for it, but you don't immediately realize how much you will pay for it. The problem is that once the virus spread, in particular in the hospital, but probably in other facilities where it is sometimes more complicated to investigate outbreaks, it's clear that once you got lost by the virus spreading too fast, you lose time, money, energy, and sometimes, of course, you lose patients. And this is totally unfortunate. So the next slide is, to me, very important because it summarizes in COVID-19 times, ideally, what do we need? If you ask me, what are my requests? What are the needs? Well, ideally, we need transparent masks with equal or better efficacy. Why? Because to work the whole day using a mask, and if you allow me, that is used on your face like that, and you don't speak, you don't see the face of people speaking to you, is something that is not very convenient in many situations in healthcare. So again, if we could make it transparent, that would be a lot better. We then need disinfectants that work with very little contact time and are safe for surfaces, humans, and the environment. So this is always the same message, but in the time of COVID, where hospital environmental hygiene is so important, we need to work fast, we need to be accurate, we need to be actually safe for surfaces, humans, and the environment. It is very important to recall that there is a room for those disinfectants to be applied very appropriately. We need real-time quality control that is cheap and accurate for environmental contamination. We need novel strategies to reduce human error because human error is so important. We need optimization of allocation of resources to where they are needed the most. And this is really important. And of course, there are many other things to develop that are coming to be. Next slide is revisiting for you the what I call the aerosolization debate. Let me remind you that the R, so the reproductive number of SARS-CoV-2, is a little higher than other respiratory viruses, but much lower than airborne viruses. So clearly, based on these elements, we cannot say that SARS-CoV is aerosolized. Technically and clinically, it is urgent to solve this issue because actually we are not using the concept of aerosolization in our protection, except during very specific patient care practices, but not in our daily life. I'm totally reassured by the data to say that we don't need, for example, FFP2 to mobilize people in the community, but we only have to keep those masks for dedicated healthcare practices. And this is the opinion of the WHO and the CDC. Next slide. For those interested, we published a paper in the Journal of Hospital Infection very early at the beginning of the epidemics by Alexandra Peters, Pierre Parnex, John Otter, and myself within the frame of the Clean Hospital movement that we have created, and that is actually looking at research in the field of hospital environmental hygiene. Next slide. The COVID infodemic is the issue I want to address next. From masks to microchips to disinfecting roads, I mean, we have seen and heard so many rumors and truths and misinformation and even fake news that really we need to calm down, we need to come back on the evidence, and we need to reassure people around those fake news. Next slide. Our goals within the Clean Hospitals movement for healthcare environmental hygiene is good education, clear protocols, direct communication, quality control, constructive feedback, and a humanistic approach. And this is absolutely key. Next slide. The Clean Hospitals is an integrative approach. Healthcare environmental hygiene network. Clean Hospital is this healthcare environmental hygiene network that is connecting stakeholders and leading experts from around the world, that is making hospitals safer through improved environmental hygiene, that is benefiting public health by lowering rates of healthcare-associated infections, reducing antimicrobial resistance, and protecting hospital staff, as well as the larger environment. And these are the objectives of the Clean Hospitals Network project that we started already more than 2 years ago. The next slide is showing to you the network where we say it's time for collaboration. We have been collaborating in the past, but it's time to have a concrete and holistic approach of the topic between experts, key stakeholders, hospitals, the industry, and governments. And this is all about the Clean Hospitals movement. The next slide is actually to revisit what is this project. It's a coalition of international stakeholders who work explicitly to promote and support healthcare environmental hygiene. Among the major activities are education and training, specialized working groups, research, publications, participations in conference and events like today, obviously, and it's a great pleasure for me to be here. The next slide is revisiting our main activity and focus area. We are working in the field of surfaces and environment, medical waste, air control, textile and non-wovens materials, water control, and sterilization and device reprocessing, in other words, to make hospitals safer. The next slide. is, will the world adapt and work together toward more preventive measures to reduce the spread of pathogens and outbreaks? To me, this question is a very key question. Now, let me develop a little bit for you. We need a change. So the need for a change in attitude toward infection prevention and control is there. We succeeded at changing the behavior with hand hygiene. It's very clear. We need to ensure sustainability in this success. But today, we need to work on hospital environmental hygiene and go to see for the same success and reach of the same success. It is important in this framework to address how, in fact, to address cost and value issues around hospital environmental hygiene. As you know, for most hospital managers, hospital cleaning or cleaning of the environment is always too expensive. But the value of cleaning needs to be reassessed so that people understand the cost and value issues around hospital cleaning. Third, improving cleaning processes and maximizing productivity should go together. And this is a long way to go until we can really succeed the way we want to succeed. Then taking a closer look at new methods and innovation is key, and we need to continue to make significant progress. And finally, we need to develop evidence-based training and educational activities so that we could spread the best of hospital environmental hygiene worldwide. My next slide is actually a conclusion slide, where I would say cleaner hospitals mean safer hospitals. So healthcare environmental hygiene is a key component to ensuring safety in pandemics. It is very, very clear to most of us, and it should be clear to everyone in the chain of important stakeholders to manage hospital environmental hygiene. We need to focus on the real dangers and evidence-based practices. We need to make sure that our interventions are safe and based in science. I will not finish without showing to you the next slide. On the next slide, I want to thank all the partners, part of the Clean Hospitals movement and project that have been started in 2018. Without those partners, we will not be able to have done so many things until now, and I'm looking forward to present to you at some point more of our results. With this, Bernard, thanking you for the invitation. We'll be ready to answer any question if we do have time.
Thank you very much, Didier. In the real meeting room, you would get a lot of applause. Now you get it from me for everybody listening. And what I love listening to you is that you give the big picture and the big perspective and the integration, but you also break it down to very concrete ideas and to the facts and to the evidence. And you also mentioned things like the infodemic, and there is a lot going on in all of the countries. And we only can fight this infodemic with data, with evidence, with facts, and with rational arguing. And this is something that I really appreciate. I would like to ask one question that is, well, specifically for you, since you're in the center of this procedure. How do you, in general, foresee the COVID situation to develop over the next 12, 18 months?
Yeah, thank you, Bernard. So I hope I will not be too much disappointing for people listening. As you probably know, I already expressed myself in several medias and people have been reacting. But if we want to be very honest with people, We are now going in every countries in Europe. Let me speak about Europe first. We are going to a period of 6 to 8 weeks that will be very, very critical to prevent for the second waves not to worsen. At a time where in many countries we have a situation that is quite stable but a little bit unstable too, where we all need to work together to A, respect social distancing, hand hygiene, and go for testing as soon as we have minor symptoms or even not. Then be respectful of quarantines. Then, of course, get vaccinated. Get vaccinated is a key. These will help us to drive us as safely as possible to May or June. Then the next step will be the summer. This summer will not be normal summer. We would need to be respectful of the barriers that would be important. Again, continue the vaccination, continue to perform well with hand hygiene, social distancing, and testing in order to have a summer where we can relax a little bit, but of course, do not make mistakes. A lot of testing will drive us to the entrance of the autumn. Next autumn will come with the respiratory viruses of the autumn and the winter, with the influenza season for which we all need to be vaccinated, because remember this year we had almost no influenza, so next year would be even more difficult. And of course, with the risk of having new variants of the coronavirus coming to transform the game a little bit. And maybe for those new variants, we would need, in some case, in some situation, these other type of vaccine, including eventually new vaccines. This will drive us to the next spring and the same time next year. And I'm looking forward to summarize it again in May next year at the Summarize Conference, because we could have a distance of all of that. But as I said earlier, only next summer, which is summer 2022, we will have to really do the aftermath of the entire period.
Thank you very much for this very open and very realistic interpretation of the situation. Actually, we do have some more minutes because the next speaker was planned to be Katharina Reich. She is the Chief Medical Officer in Austria, and we know her quite well, and she was very excited to be here. And 5 minutes before the conference, she called me. And she told me that she has been called to our Prime Minister now at 2 o'clock because the situation is so dramatic, not only everywhere else, but also in Austria, and they have to define the next measures. And she gives her apologies, but this shows how dramatic the situation is. You don't even get her for a 25-minute presentation in this conference. But let me get back to one argument that worries me personally. If you look to the entire situation, you mentioned that vaccination is a key element in the entire management of the pandemic. If we now look to Israel, Israel has by far the highest degree of vaccination, almost 50% of the population. They are doing a fantastic job, but still they are entering the fifth phase. And the fifth lockdown, despite the fact that so many people are vaccinated. Is the vaccination not working, or what is happening?
That is a very important question, Bernard. It's very clear that the vaccination is working. Now, it's clear that we will have some differences from one region to another. Don't forget to see that we have very good data from different countries, in particular in the UK, in Israel, where we can see that the vaccination, for which the target was the older population in most of the countries around the world, has reduced already mortality among these aged patients, has reduced the number of admissions to hospital by these patients, from these patients, and has reduced admission to critical care too. So it means that this is really helping not only to save lives, but to allow our hospitals to continue to work as good as they can. So I think that's the background, and that's why we need to continuously promote the vaccination. The vaccines are outstanding. The RNA vaccines are unbelievable and outstanding. And the other vaccines, most of them are really, really good. Unfortunately, some of the variants, in particular the South African variants, are not as sensitive to the immunity than actually most of the other coronaviruses that have been tested or have been documented. So this is telling you that when the coronaviruses, all the viruses are under pressure, they could develop resistance to the immunity, sometimes to the variants. So the mutants are there. We need to consider them. We need to be very careful. We need not to stop our capacity for surveillance. That's the most important. And everybody should continue to be more respectful of the guidelines for behavior. And that's very, very key. Remember, if everyone apply hand hygiene and social distancing, there would be no pandemic. Okay?
Absolutely.
So I think this is really important. You know, in our country, the vaccine was provided only to the more than 75-year-old people for a long, long time. And people were asking me, why are you not vaccinated? And I said, just because I'm respectful of the age population. And in addition, when it will be my turn, actually, it has been my turn already, but when it will be my turn, I will get vaccinated. But in the meantime, I'm not anxious at all because I know that hand hygiene, social distancing will make the job, right? So I think that this is really, really, really important, as well as testing.
Testing. Yeah. Thank you very much. I've got more questions from the chat now. And if you have 5 more minutes, Didier, I would like to ask them to you. The first question is, what are the key gaps in the evidence base that you would prioritize, especially to convince the non-specialists?
Yeah, well, there are many things that are missing to us. In particular, you know, most of the countries, and now I have been studying all countries around the world, but mostly the European countries, the best models in Asia Pacific, the USA and South America. What we really need, we know that lockdowns work, right? But they work at reducing the number of deaths, the number of hospital admission, but unfortunately, they are associated with all sorts of trouble. Non-COVID patients sometimes do not have the same chances as COVID patients, which is totally unfair. Economic damages regarding lockdowns are huge. Social damaging are absolutely huge.
Enormous.
Now, what we need is really the best science to be sort of asking the right questions. What are the most important activities that we should not do because they are at too high risk for COVID-19 transmission? We have some evidence in the literature from the first wave, and we are now going to understand better and get more information from the second wave. The gathering of people is the number one. So be respectful of not being too much together and having parties and things like that, because that's the most important. You know, the small gathering at home with friends or even at work, but not when you sit at your office, but when you go to the cafeteria or, you know, in doing some social activities at work are the most important parameters. It seems to be the case. So that is very, very important because we want to have as much activity as possible, but as low as possible transmission of COVID. Schools, for example, today it is quite easy to say, let's close the schools. But the impact of closing the school is not that much important on the spread of COVID, except in lockdown situation, but it has a huge impact on the children, a huge impact on the education, whether it's young children or people at the university who nowadays get depressed when they are locked down. So this is what we need to drive these issues. And of course, with all sorts of behavior help to make sure people apply hand hygiene, social distancing, which is absolutely the key to control this pandemic.
Thank you very much. And I think this is absolutely true. You always have to balance the benefits and the downsides of a measure. And you cannot just go in one direction and cause a huge damage on the other side. There is one more question that I'm reading now from the chat. Dear Professor Pittet, thanks for your open view on COVID outcome and timeline for Europe. What is the outlook for Asia and Africa? And how do you explain the low transmission and low morbidity and mortality in low-income countries?
Yeah, well, it's a long question. Maybe next year we'll have more data for that. But in the Asia Pacific region, the country who are the model country all reacted extremely quickly to the pandemic. So most of them went to lockdowns very, very quickly. But before that, they did testing and tracing and isolating activities extremely intensively and extremely fast. And this is the key for success. Then they had extended lockdowns in some situations. And the idea is not probably to kill the virus, which is not possible, to eradicate the virus is not possible, but to keep it so low that then you can control all the transmission, the cross-transmission chain, and then get vaccinated in the population, and then a reopening. So that's the idea. Now, to answer, and it is working, but as you can see now in New Zealand, they have a new problem. In Australia, there have been a lot of lockdowns, and the economic and socio-economic issues will be very important, and so on and so on. And in China, they succeeded in some region, but actually they have problems in others. So it's not easy to answer. Regarding the developing countries, I must say that there are some countries where we don't have data that are so valid that we can really drive conclusions. We have to recognize that in Africa, for example, where the average age of the population is much younger, the impact of the pandemic is relatively not as important as in our population where people are much sicker. We have to understand that we are not at the end of the story, but in some developing countries or mid and low income countries like if I take Mexico, Brazil, I mean, the pandemic is a disaster, So despite of the fact that the average age of the population is quite low. What I want to say to sort of conclude with the answer to your question is, personally, I don't want anybody to get COVID. I have seen very young patients sick of COVID. I've seen young patients dying of COVID. So we all agree that COVID mostly kills old and very old patients. But unfortunately, in countries where the control of the pandemic, like in the United States of America, where the control is not good, you have impact in all age categories. And these, I cannot tell you more about this, but it is evident from the comparison that we do of the impact of the crisis for the French government, that where we do it also for as a comparison for worldwide, and that would be delivered at the World Health Assembly next May in Geneva.
Okay, thank you very, very much. I think we are pretty much at the end of this time, and the next lecture is waiting. We have fantastically bridged the gap that Katharina Reich should have filled with her lecture, but maybe she can link to the conference later on. Thank you very much to you for your openness, for the information that you gave to us, and I have to also say we really hope to have you here next May in a safe environment personally and host a fantastic conference with the COVID mostly behind of us, but we will see.
Well, it is reasonable to say that it will be feasible next May. I'm pretty sure. I think that if overall the behavior of people is okay, if we continue to have this vaccination, and plus the in place to have things on the spots that works. And I must tell you that we are currently organizing the ICPIC meeting for next September. That will be in presence as well as part of the sessions in virtual from the 14th to the 17th of September 2021. So we could reasonably think that it will be a presential meeting, and I'm almost positive that next May we would have a positive and presential meeting in the Semmelweis Foundation.
Absolutely, and I hope to see you soon, hopefully at the ICPIC meeting, and all the best for your efforts to keep this thing going, and then we will stay in touch. Thank you very much.
Bernard, thank you. And thank you to everyone. Thank you. Bye-bye.
Thank you. Goodbye.